Growing up, it was hard. Didn't have access to health insurance. We didn't have health care until I think it was about in 5th or 6th grade when New York City had those programs where children all had to be insured. That was the first time, my parents could take care of my health in a very real way. And it brought dignity back to my family and parents. And so that's sort of what I think about on a constant basis, bringing dignity, especially in such a scary time when anyone's seeking healthcare. And I think that's what NADAP also brings to the table every single day. I would define social determinants of health as everything that affects the patient's or person's healthcare, health, life, really. It's everything related to their job or having access to income, their housing, their nutritional capacity, sort of even just of having access to supermarkets, how all of that comes together to have an impact on a person's life and thus their health and healthcare. While NADAP's been doing this work for the past 50 years and it's important work just in general, there's no greater time for this work to be supported and enhanced across New York City especially, because as we all know, we were rocked really hard during the COVID-19 epidemic. We know that we have to take a different look and different approach to the recovery, but also supporting everyone as they're facing the pandemic. The isolation, how that can affect mental health, as well as addiction, as well as access to preventive health, things like that. Those can't fall by the wayside just because we have a public health crisis. And like I said, the data is there. Taking care of the whole person is going to affect their healthcare positively and health positively, but also the economy and the well-being of our entire city.